Hi, this is Dr. Jessica Daigle, and I am the founder of Mom and Me by Jess MD. And that is a in-home postpartum care practice designed to help moms and babies ease the transition from birth to home after they've had their baby. And so you wonder probably, what is this fourth trimester when you've seen our ads and our posts talking about how to prioritize sleep during this period? Well, the fourth trimester is the first 12 weeks after you've had your baby. And there's a lot of things going on during that time. One, you're adjusting to a lot of emotional and physical changes as a mom. If you're a new mom, you're adjusting to the role of being a mom and what that means, having a whole new little person for whom you're responsible. And then the baby is also undergoing changes. And one of the challenges of that time is, how do I really sleep when I have this little being that I have to care for around the clock? So to talk about that with me today is my friend, Dr. Funke Brown, and she is a pediatric pulmonologist and sleep medicine physician, and she is the founder of Restful Sleep MD, and she helps professional women and their families prioritize sleep so that they can live their best lives. Okay. And so we want to help our listeners, our moms and friends out there, figure out how to get their best sleep during this time, which will help you set the foundation for sleep forever. As a new mom, if you get this down now, you'll be able to know how to prioritize sleep even as you continue to through this period and as your children grow. And so, Dr. Fawn Brown, thank you for joining me.
Yeah, yeah, I'm so
Yeah.
excited. This is good. This is good.
And so if you're watching, say hello in the comments. We are wanted active participation from our listeners, and definitely put your questions in there. We'll have a session for answering questions as well. And then if later on you're watching a replay, you could put #replay. So one of the biggest questions that I get from a mom as a pediatrician who rounds in the hospital in the NICU or the nursery is, how do I really sleep when I am taking care of a newborn baby? They require care every 3 to 4 hours because they're eating frequently through the night. And I'm the one, especially if I'm breastfeeding, I have to be the one engaged in feeding them. So how can I really sleep during this time? So what would you tell a mom, Dr. Brown, who is trying to sleep after having a new baby?
Yeah, I mean that's the question, right? I think one of the things that's happened is your baby, like you said, the baby is undergoing so many changes. And you as a mom, there's hormonal changes. You just went through the most life transforming experience. And so your body, your body is undergoing changes too. And those hormonal changes are there. And then on top of that, there's all the responsibilities in that sense, like everything you need to do, cater to the baby, feed, change, rinse and repeat, right? So the important thing is to get it when you can. I think within those first 12 weeks, the baby doesn't necessarily have a set schedule yet, they don't have a rhythm yet, and so you really have to just try to get it when you can. I think that's key. And, we'll go into details over the course of this talk as to how you can make that happen. What does that really look like?
Okay.
But if you're looking for like stretches, of course, that's going to be very hard to find. But
Okay.
then what do you have and how can you take advantage of it?
That's true. I think one of the biggest pieces too is looking at the support system that you have at home.
Mm-hmm.
One of the things I know I had to do was when I got to a point, I was a breastfeeder. So when I got to a point where I had enough supply, I would pump up a little bit, and then my husband would take over like feedings from 10 to like 2 or 3 a.m. because he liked to sit up and watch the news at night. So we were able to tag team that
Yep.
and say, all right, well, you'll have the baby at night. And they kind of served as their bonding time while I also rested,
Yeah.
and which was still conflicting because then, when your body is used to a little person like taking from you too, then you deal with a little bit of engorgement sometimes because then, that milk is like still there needing to be expressed. And so
Yeah.
sometimes it could be a little bit uncomfortable, but at least I would still get a little bit more, like even if it was 3 to 4 hours. Like you said, I tried to maximize that time. So that's good to know. So I think to be clear that it's not going to be that full 8 hours of sleep that you're used to. I think just knowing that that's key and that's realistic probably will make a lot of moms just know, hey, this is just like a phase, just like when you're
Yep.
pregnant and you're uncomfortable.
Mm-hmm.
Like, this is a phase, this baby is going to come. So,
Yeah.
the back pain and the stomach pain will get there. Okay, so
That
you
is so true. That is so no, you bring up a really important point. I think the first thing is realizing that, it's all a phase. It's gonna get better. It's gonna seem
Mhm.
like it's forever when you're going through it, but there's an end to it and things do get better.
Okay. So I know that we were talking about having this talk, you had a couple of questions that a lot of your listeners had, and I think that would be good to kind of go from what people wanted to know during this talk to be able to kind of set the tone for some of what we can talk about. So one of the question was, what is a reasonable goal for how much sleep to get as a new parent? So when you talk about getting sleep as much as you can, what would be like if they were keeping track of their sleep in a 24-hour period? What would you tell a mom as far as, okay, these are the number of hours total that you might want to get some sleep?
Yeah, I think and thank you so much to those of you that did send in your questions. It's really helpful, so we know what the pain points are. Um, in terms of the number of hours of sleep, the recommendations don't change. Honestly, it's still for adults about 7 to 9 hours, but there's studies that have even shown that most new moms in this postpartum period are getting maybe like 6 hours, even if. And at the end of the day, they end up occurring in little bouts, essentially when the baby is sleeping. So you still will strive for as much as possible to that goal. I think just in terms of getting enough sleep for your own healing process as a as a mom in the fourth trimester, and just for your own mood and energy level and things like that. So you still will strive for as many as possible. You know what I mean? So even if you're only getting six, unfortunately, maybe that's where you are. Your baby's waking up frequently and things like that. But the idea is to try to prioritize it as much as possible, so you're still hitting as close to that 7 to 9 hour range as possible.
Okay, that's really good. That's a good tip. That is so awesome. Thank you for that. And then what someone was saying that sometimes they find they need time to decompress before falling asleep. So what are your tips for how to unwind when you're falling asleep? So you can sleep when your baby is sleeping. Because, I know one of the things I struggled with was, well, when my baby was asleep, outside of wanting to do like chores or get things done around the house, sometimes I was worried about them. So I'd be looking at them like, are they breathing or is everything
I
okay?
know.
And you were afraid to go to sleep because you hear so much horror stories about SIDS and different things, and we probably can even touch on a little bit of that. But how what are some tips for, okay, like now I'm resting, I'm actually feeling okay that my baby is settled, how can I really prepare myself to get into some good sleep?
Yeah, that's a really good question. Especially, you're right. Like if the baby is sleeping, especially in that newborn period where maybe you're getting stretches of max 2 hours, 3 hours at a go, like how do you incorporate a routine for yourself to kind of decompress? I think the key is finding what helps you relax. You have to find that out. For some people, it's maybe listening to meditation. For some people, it's listening to calming, relaxing music. Um, for some people, it's setting, I think it's important to set an environment that promotes sleep for you. So
Yeah.
make sure the temperature is cool, make sure the room is, relatively dark, make sure that, you're wearing something comfortable, you're not in pain. I think that's important. Now, also making sure, I would encourage you to have a routine at bedtime at night. So you
Okay.
don't want to, while you're taking advantage of those napping periods in that sense during the day when the baby is sleeping, at night as well, you want to try to separate it, because there's that tendency to get into this 24 hours
Oh,
spiral where it's like, is it daytime, night? I have
that's
to,
true.
I remember with my kids as well, you're like, wait, what time and what day is it? Because
Yeah,
everything becomes this continuum.
that's
Um,
true.
one of the things I would say is still try to create a little mini ritual for yourself at night, such
Hmm.
that you're still hygiene is something we still need to remember. You still should try to take a bath, you should try to,
Yes.
it doesn't have to be like this whole long drawn 45-hour thing. Sorry,
Okay.
45-minute thing, but
Yeah.
you could still incorporate elements of some kind of wind down routine for yourself, put away the devices, take a nice warm bath, put on some nice lotion or something, some PJ,
Oh,
something that
yeah.
you like that really helps you get to kind of unwind. I think it's
Okay.
good to incorporate it just for your brain to say, okay, now is now is nighttime, even if it might be a short night. Um, Really making that a habit.
That's good. I was thinking too about the importance of with especially now that we're with daylight savings. I've heard a lot of people having struggles with that too, like feeling like their kids are all out of shape and
Yes,
been out of
yes.
shape. And so I told one of my friends is a new mom to get out early in the morning, like when it's daylight, and maybe even take the baby for a stroll, like in the neighborhood, especially if you're comfortable and you feel like it's
Hmm.
safe for you. And getting that exposure to that daylight actually even helps with your circadian rhythm. Is that something that you would recommend as well?
Yeah, that is so important. So even though your baby is kind of sleeping all day or awake all day, or I'm sorry, sleeping all day and, kind of very has this sleeping episodes,
Hmm.
it's still important to ensure that, over time they're starting to identify what's day and what's night, right? And
Yeah.
so for you as well, for you as a new mom, for your mood, it's really important to incorporate some form of activity. So you're not just in the house all the time, walking on tiptoes and the house is dark. It's nice,
Yeah.
it's good to expose yourself as well to bright
Okay.
light. So going out on a walk with the baby
Yeah.
as well, make sure they're
Yeah.
nice and bundled if it's cold.
Yeah.
It's really, really important with your mood to reset your circadian rhythm, and also for the babies to start to differentiate between, okay, it's bright out, okay, it's dark when it's, at nighttime. If you're in a place where you really can't go out, even just keeping the windows open and putting them close to the window, I think is also helpful, because that way they're getting that
Oh,
natural light. So that's a very helpful tip.
that's good. That's good.
Mm,
And it's interesting that you talk about that too, like when you're saying like as part of your care and put in routine, a lot of that is to do with like self-care. And I
yeah.
have to I find I spend some time encouraging my families when I see them to not forget about themselves now that they have the baby. You're right when you said earlier that, when the mom is pregnant, there's so much focus on the mom, and they're treated like with such care, and it's like everything's like, oh, you're pregnant, let me like accommodate you and everything. And then and then you have a baby, it's like you're supposed to just like snap back and
I
like,
know.
no, you still actually are healing too, and going through transition, you'll just cry for no reason. I had a mom today, she was like, I went to see her, she's like, I'm just crying. I was like, I get it, I still have those moments, and my kids are older.
I know, right?
I
And
think it's just part of being a parent.
that is so true. But that is the thing. Like when the baby is born, you're hearing, oh, how many is he? How often is he waking up? What's he feeding? How's he sleeping?
Yeah,
Nobody. I mean, people may ask, oh, how are you? And that's it. And
yeah,
then they
yeah,
just move on to the
yeah,
baby.
yeah,
And
they do.
and so we just forget that the mom needs some care as
Yes.
well. So
Yeah.
I would say, don't forget yourself. Don't forget to because if you prioritize your own sleep and your own self-care, you feel better and you're better able to care for that baby. So it's really
Yeah.
important to pay attention to moms as well during this period.
Yes, I have to tell them not to feel guilty too. Like it's
Yeah,
okay to, have an hour to yourself to do something that you still enjoy, because you're still you, even
yes,
as your mom. You have a new role. You're not necessarily have to be a new whole person.
yes,
You
yeah,
you have another task, another job, and it's
yeah.
really quite special because, like I've said in some of my posts, this is the one job you don't get any like pre-training ahead of
It just
time.
shows up.
Nobody
It
lets
just,
you like come on the job and try it
yeah,
out and like tweak this,
I'm
and
telling
you
you.
might want to do that first and then say, all right,
Yeah,
now you're ready. No, you just have to show up and get it done.
I know.
So
And
you have to give yourself some grace.
that is so true. And you know what you said, like nothing really prepares you. Even if you've read all the books, your
Yeah.
child is a completely different individual and may read the books or not read the books. Most likely won't read the books. So you
That's
just
true.
have to, so you just have to know that even if people say you have to do this certain way and you must
Yes.
do this and this, that, and they have this
Yes.
whole 10 long list of things you must do,
Yeah.
you have to find what works for you.
Yes.
You have to create
Yes.
that space to say, listen, this is me, this is how I'm going to approach it, and find a system that works for you. I think that's really important.
Okay. So one of the biggest things too of prioritizing sleep is making sure that the environment is safe, even safe for your baby. So the AAP talks about making sure your baby is laying on their back in their own sleeping space, which can be a crib, a bassinet, or a pack and play. And so, do you find that you struggle with families kind of still wanting to co-sleep? And then that's the first part. And then I don't know if you're aware, but the American Academy of Breastfeeding Medicine is a little bit more relaxed about their co-sleeping, because especially for like our breastfeeding families. So as I've just been curious as a sleep physician,
Hmm.
what is it that you educate about like safe sleep for babies, even considering those who are breastfeeding?
Yeah, I think I'm on the side of the AAP on that one.
Okay.
Just because as a mom, again, as a new mom who is most likely sleep deprived, right?
Mm-hmm.
We're talking
Yeah.
about trying to get as much sleep as possible, exhausted, and then
Mm-hmm.
you have the baby waking up in the middle of the night. Um, you might doze off. So just for
Yeah.
safety reasons and things like that, I think co-sleeping in the same room is really encouraged, right? So you're not getting
Yes,
up and walking all the way,
that's
especially
right.
for a baby that's waking up so frequently. Having them in a bassinet that's really close to you, so you can just get the baby and feed the baby and then put them right back, is really important because that's just what's been shown to be safest to decrease the risk of SIDS and things, especially in the setting of a mom who's somewhat impaired in terms of sleep, right? So I
Yeah,
think that's
that's
really,
true.
you're not your most alert, right,
Yes,
during
I
those times.
agree.
So you're just bringing the boob out, feeding the baby, but you're not
Yes,
necessarily going to be
yes,
ready to solve calculus. So
yes, yes,
your risk reaction time may be a little bit slower and things like that. So
yeah,
I think it's just safer to know, okay, my baby's right here, right next to
yes,
me, but in their own safe space. And
yes.
if they need me, I'm right there for them. So
That's good.
that's what I would
That's where
lean
you
towards.
stand. And I
Yeah.
go with that too. I always tell people, is it possible to fall asleep while you're breastfeeding? This is true. And so I tell people not to, like our moms, not to give themselves such a hard time, like to be
Yeah.
vigilant as much as you can. And that's why I think when you have a partner or a support person that can be like that other, like accountability person, like,
Mm.
hey, we've drifted off here, and that's why some people will say, to get up and sit in a different chair, maybe to breastfeed
Mm.
too. Sometimes, especially in the middle of the night when you're most tired, then that way you're not like in your cozy bed space and things. So, like you're right, a lot of that is figuring out what is the strategy that makes it safest for you and your baby. So that way you're not living with any type of regret for any decision that you made, in regarding like safe sleep too, because that's definitely so hard. I've definitely taken care of families of babies with SIDS, and that's definitely something that I would
Mm.
not want any family to have to endure. One
Yeah.
of the other things that kind of came up is like some noises that babies can make while they're sleeping. And so I always have to educate families that babies are nose breathers. And so, they've been swimming around in fluid, which is, very moist and everything. And now they're in air. And so the way I explain it is that, now you have air traversing those nasal passages. And so sometimes, depending on the birthing situation, there could have been some swelling, like coming out of the birth canal, especially vaginally. And so that they'll be hear a lot more noise, but to look at their pattern of breathing, like if they're in distress, and or if there's like mucus plugs or things like that in there. So are there specific noises that would alarm you as a sleep medicine physician of a baby, taking care of a baby that might make noise as they're sleeping?
Yeah, babies do make all kinds of noises. The main reason you see is nasal congestion, like you
Okay.
mentioned, just through this birth process, which, over time tends to improve. Sometimes if the air, around them is really dry as well,
Okay.
that can also contribute to congestion. And so you hear that. But we have to differentiate between snoring and just that sort of more congested breathing. I think sometimes we mix it up. And so
Okay.
a baby should not be snoring.
Okay.
Snoring is not normal.
Okay.
A lot of the noises most people hear is more of that congested breathing,
Okay.
because air is kind of trying to pass through a little bit of a restricted nasal passage.
Yeah.
And so that's kind of different from like snoring. I just made
Okay.
one.
Yes.
It's
Okay.
very distinctly different. If
Okay.
you ever are not sure, what I recommend that you do is record your baby's breathing and then send it off to like the pediatrician or something like that so they can
Okay.
confirm.
Okay.
If you have snoring, and snoring may be a sign of a condition called sleep apnea, and that's
Okay.
when children have pauses in their breathing, because they have narrowing of their upper airway during sleep. And
Okay.
that's something that should be treated because it has a lot of consequences that's not good. So
Okay.
if you do think it's snoring, I think is just safe to, record it and send to the
Okay.
pediatrician, make sure someone takes a listen and kind of reassures you
Okay.
about it. Yeah.
That's good. And so, like, I'm used to thinking of apnea like in preterm babies, which has more to do with like their brain being a little bit, their respiratory center
Mhm.
being immature. So you can, as a newborn baby, can actually have like sleep apnea as a newborn baby. Look at that.
Yeah.
This
Yeah.
is news to me.
It's really it's actually it's not. Sleep apnea is commonest in like children between the age of say 2 years old to 8 years old,
Okay.
but there are quite a number of newborns and infants that can also have sleep apnea, usually due to other reasons. The most common
Okay.
cause of sleep apnea in children is because of big tonsils and adenoids. Tonsils are the tissues at
Yeah.
the back of your throat, um, or adenoids, which is kind of a little tissues behind your nose as well. In infants who have sleep apnea, there are different causes. A lot of it is anatomic. So
Okay.
sometimes you can have infants that have sort of a smaller jaw or like a bigger tongue. And what that does is it kind of makes the upper airway narrow. And so that can cause
Mm,
some apneas because things kind of get more floppy as you sleep. And
okay.
so that's, like you said, a little, it's different from the central apnea that you might see in premature babies, um, because that's really due to more of a brain development, like
Oh
the
yeah.
brain's just taking time to develop and things like that. But for more term babies, you might see apnea due to, again, you can see them in children who have different underlying syndromes, genetic syndromes like Down syndrome or Prader-Willi syndrome. So there's
Yeah.
some genetic syndromes
Yeah.
that can manifest as sleep apnea in the newborn
Okay.
period.
That's good to know. Look at that. I'm even learning something, I tell you. Well, so we've talked about a lot of good things. Let's see if anyone has any questions here in the. Thank you for all who are here. I don't really see if anyone has any questions. We can maybe give a few minutes to see if anyone
Hmm.
present has any specific question. But we've been having some really good comments about there being some really good tips. And one,
Awesome.
Dr. Tamara Beckford said she really liked how incorporate a night routine for a mom, which is so true. It's kind of taking back some of that normalcy for yourself, like using your favorite lotion, things that bring you like joy, like you
Yeah.
said, like if it's a certain music or a certain scent or a certain experience that makes you feel rested. I remember reading a post recently that said like if you just want to stand in a hot shower, or the cold shower or whatever.
Just
I was like,
exactly
that's
whatever.
true. That's
And it
true.
doesn't, you can do it without like it taking up the entire sleep period of the baby, the
Yeah.
entire period the baby is sleeping. So
Yeah, that's true.
you can be, you can be effective in your self-care.
Yeah, yeah. My thing now is to tell family, like, is to for families is to normalize and strategize.
Mm,
Like, explain that the things that they're dealing with are normal, and then
mm,
say, okay, now what is a strategy that you can use to kind of help you thrive during this time, and
yeah.
set a good tone for how you feel. So I don't really see too many other questions at all. Is there
There was
anything else? Oh yeah, you go ahead.
there was one question I had gotten about um, what's the relationship between breast milk production and sleep? And I
Huh.
think that's a really fascinating question,
Yes.
because so melatonin is the sleep hormone.
Yes.
It's we call it the hormone of darkness because it comes out in the dark, and it helps promote sleep. Now, in the newborn period, the area of the brain that produces melatonin, the pineal gland, is not completely developed. So that melatonin production is not fully in, it's not in full gear in that newborn period. Usually will start somewhere around 2 to 3 months or so, give and take. And
Okay.
so that's one of the reasons why your
Mm,
your baby is not sleeping through the night and doesn't have a clue of when is daytime, when is nighttime, because and that's why you wouldn't try to sleep train your
yeah,
newborn, because the tools they need to be able to sleep for long enough is not really set in.
that's good.
One, I think this is just a way, because this is the way that is built in, is because babies need their bellies are so small, so they need to
Yes,
feel sleep.
yes, they
They
need
need
the
to wake up
nutrition.
frequently.
Yes,
Exactly. So,
agreed.
um, and so the melatonin for mom helps the baby, but one of the things about it, and the melatonin studies have shown the melatonin that you get in the breast milk at nighttime is it follows the same circadian rhythm, so it's higher, and then
Okay.
during the day it's lower. So if
Wow.
you are, the reason why this is important is if you are expressing breast milk, it's important to label the time and the
Ah,
day. So if you have breast milk that's uh, pumped in the morning, you want to label it as morning. And so when you want to give your baby, you want to give it in the morning. And then the nighttime breast milk, you want to give it at night. So that's definitely something that to be aware of. A lot of times,
that's
most folks are not
good.
aware
I
of
don't
that,
think
but
I,
that's
yeah, I
something
don't
that,
even know if I even thought about it. Huh,
yeah,
that's
yeah.
interesting. I think I just more so was concerned with knowing the date just so I can know how soon I needed to use it.
I know, I know, that's also important.
Like, okay, this is
Yeah.
in the freezer, this is in the refrigerator, this is in my deep freezer. Okay, let me go in order.
I know.
So I can use my older milk, first or whatever.
Ab-
So that was all I was concerned about. So that's good to
I know.
know. That's
I know.
awesome.
I
Look at
know.
that.
I
That
know.
is so cool. I hope that that definitely is helping one of our viewers.
Hmm.
One question she had is, my baby does not sleep as long on a flatter surface versus propped on a boppy. So what are your thoughts about that? About like sleeping long on
Yeah.
one surface versus another?
So the ideal is when you're again siding with the AAP, the American Academy of Pediatrics. There's the eight ABCs of sleep, where which they
Hmm.
talk about the your baby should be sleeping alone, they should
Hmm.
be sleeping in on their backs, and
Hmm.
they should be sleeping in a crib or a bassinet.
Hmm.
And you want to avoid anything around them that can be a risk for suffocation and things like that. When it comes to propping babies up, I would say be very cautious. The
Yep.
reason why is, they're still trying to develop tone,
Hmm.
right? They're still a little floppy. They don't have good head control and things
Yeah.
like that. So if they're propped, you have to be cautious that they're not compressing their airway,
Yeah.
because that may prevent them from being able to breathe well. And that's why sleeping in the swings and the car seats and things
Yes.
like that is not really something we encourage.
Yes.
I mean, if they want to take a tiny power nap and you're like watching them closely from time to time, but ideally you really want to lay them flat on their backs. I know people also talk about, oh, well, my baby has reflux, and so I
Yeah.
prefer to have them propped up. Again, ideally, still, we would recommend a flat surface. The
Yeah.
only thing I would recommend is if you do have a baby who has reflux, maybe making sure you burp them really well
Yes. Yes.
before laying them down. So
Yeah.
that would be ideal.
Yeah, and even for me, I remember because my son was preterm, we did have to
Yeah,
keep him upright a little bit more after feedings, and
yeah.
so that would be the time I would just choose that time to like be like the cuddle and bonding time before I would
Mm,
lay him down for that reason too. And that's also why I even encourage my families to just turn the head side to side. One, for dealing with plagiocephaly, because with that back to sleep came more of that flattening of the head.
yeah.
That was a
Mm.
concern, and then do we need a helmet or not? Later on. But then so I was like, well, turn the neck. That helps with like strengthen the neck. Each time you lay them down, you can lay their neck one side or another side, and that kind of helps too. If they bring
Mm.
up anything, a lot of times they can like pull it into their cheek, and you can kind of
That's
get it
true.
out of there. So those are a little bit of strategies I even remember using. Do you think that? And I don't know in this person's case if there's anything with airway. Does that seem to help, like with it, like? But you saying that propping actually might compress more of the airway versus the idea, like sometimes we think, and this is one of those things parents do a lot, is we put a lot of what we know as adults onto our babies, right? So we think, like the same way with the neck rolls and the car seat, is like they don't really have a neck right now as a baby, like that big.
I
So
know.
they're not thinking like us when we're on the plane and we want the neck roll for comfort. That's because we really have a neck. But we
Yeah.
think, oh well, we want a neck roll, so our baby's gonna want one, but it's not necessarily true. So
Mm-mm.
we always have to be cautious that we're really thinking about what is it that the baby needs as a baby, as opposed to in our adult perspective.
Exactly. And I mean, the idea is to have them on their backs as much as possible. Now, when they become like 4 to 5 months and start like
Yeah,
turning
they're gonna
over and
start
things,
turning themselves.
still
Yeah.
put them on, still start sleep on their
Yes.
backs,
Okay, good.
ideally, and then whatever, if they turn, they turn. But
Yeah, they do.
I think that's just something that has been shown to reduce the risk of
It
cysts,
does. Yeah.
as well as things like breastfeeding, and
Yep.
then things like pacifiers
Flyers that
as
help,
well.
and
Those are
not being
some.
in a smoke environment as well too. Those are
Exactly,
like the key
exactly.
ones.
Yep, yep,
Yeah,
yep.
one more question too. Why would a baby be more congested at night versus the day? Now, I would probably answer that it has to do probably with air, like you mentioned, the air being drier. And I
Hmm.
often encourage my families to get humidifiers, like the coolest humidifiers. So, what are your thoughts about humidifiers, and even like keeping them clean, how to frequently clean them, and things like that too? What are your tips for that?
I think especially in the winter months, you see that frequently where the air just seems more dry. A humidifier is totally fine. You just don't, of course, you don't want to have it too close to the baby where it's now like your baby is wet by the time you wake up. No, maybe about, like to some distance from the baby, but enough whereby the baby can still get the
Okay.
benefits of it, right?
Okay.
Um, the one thing I would say is humidifiers, again, also you have to be careful not to run it too high or too fast.
Okay.
Um, and then because it can cause an increased risk of mold, and mold can deposit. So one of the things we recommend is just cleaning frequently. So
Okay.
taking it apart and washing and cleaning.
Yeah.
Um, Distilled water is usually ideal. Is
Okay.
actually better because then you have a less of a risk of buildup of
Okay.
minerals and stuff
Oh
like that.
yeah, that's
Yeah, but the
true.
key is just washing and cleaning the filters to make
And
sure
letting
that
it
mold
air
doesn't.
out too
Yeah, yep, yep,
properly.
and let it
Okay.
air out exactly.
Yeah, because I went to look in one time and I was like, oh, I was like horrified. I was like, oh my goodness.
I know. You don't want to trade one problem for another.
Exactly. Be like, now my baby's not congested, but now I'm concerned about how they're breathing, you
I
know.
know, I know, I know.
Well, that's so
Yeah.
good. Well, any other questions that you have from any of your viewers or
Uh,
hosts?
no, I think one of the things I would say is I'm sure we've all experienced it. I mean, I can say my sleep changed after I had babies, right? So, um, and most people was there are different reasons why that could happen. Um, if you had insomnia before you had the baby, it's
Hmm.
gonna be present after you have the
Okay.
baby, and it may linger, even after the fourth trimester. Um, and so that's just something to be aware of. I think, just like you mentioned, practicing healthy sleep habits, even in the fourth trimester, is something that's going to help you on the long term.
Hmm.
And there are other reasons why. I mean, of course, we know that there's situations where there are reasons why you may not be getting the sleep that you need at this time or you require, and that may be because the baby is waking up to feed, or you're also undergoing, your body is also going through so many changes. But at times, also, one thing you have to be conscious about is the postpartum depression, which is a real problem. So if you're
Yes.
doing the best you can to prioritize your sleep, you're practicing as healthy sleep habits as you can during this time, but you're now at the point where you're suddenly having episodes of complete fatigue, anxiety, mood swings that are, like you said, sometimes you just cry and you can't really explain why. But if it's now something that's now really persistent and to the point where you're getting into bed, your mind is racing, the baby is
Yes.
quiet, everything's good, but you can't sleep,
Yeah.
it may be time to seek professional help,
Yes.
because it's
That's
not
so
something
important.
that you should go through alone. It will
Yes.
affect your sleep, and it's a vicious cycle, because if you don't get enough sleep, your mood is worse, and then that kind of spirals
Yes.
the postpartum depression. So do seek help if you need it. Get out there, get some sunshine, get some, get active as much as you can,
Yes. Yes.
and give yourself space to heal.
Yeah, yeah, and definitely. I know someone I was working with mentioned isolation, and one of the
Yeah.
things I encouraged was, well, during the time of COVID, everybody has had to adjust.
Yeah.
When you normally would be able to take your baby around a whole lot of
Mm.
people and different things, family moms are finding themselves being cautious. And so one of the things I encouraged was to set up a Zoom or a FaceTime
Oh,
call with
wow.
some family or friends, like, and you could
That's
even
awesome.
schedule it, and
Mm.
then they can still see the baby. You can still engage and laugh about like little antics, and it's kind of almost like you're still there with the person, but it'll
Yeah.
help take your mind off of the fact that, well, while you may not be able to physically get there, you're still
Mm.
able to have that interaction and
Mm.
conversation, which is often just a little bit of what you need. Just break up that routine, have some conversation, a laugh
Yep.
here or there,
Yep.
and that'll definitely help. But I do definitely appreciate you mentioning how sometimes the lack of sleep, just as much as too much sleep, can sometimes be signs of dealing with depression. And so
Mm.
it's really taking stock of yourself and being okay with asking for support. And that is
Yes.
one of the biggest things of
Mm.
during the fourth trimester, is with all these challenges, I think, especially with women, feeling the need to have to be able to do it all. Because maybe
Yeah.
previously, prior to having a baby, you were that person that was taking care of this and that and this and that. But once you're going through this change, you ought to be a little selfish and say, okay,
Mm.
now I need to just focus on me. And if I need someone else to do certain tasks, that's okay. It's not a sign of weakness. It's actually a sign of strength to ask for help.
I
Yeah.
love that. I love that.
Yeah.
I love that. And I think you had mentioned earlier also your partner or spouse really getting them engaged,
Yes.
and making sure, like, even with the teams, like, if you guys can tag team.
Yeah.
So in terms of the feeding, so if you're pumping, if your milk is sufficient enough for you to pump, you can skip one awakening, so you
Yeah.
can get a stretch of sleep, and then your
Yeah.
partner can feed them, and
Yeah.
really getting the help, whatever help you can get, if you feel
Yes.
comfortable with getting. Don't be afraid to ask. It's okay.
Yeah. Yeah. It's okay. Well, this has been such a good
I
discussion.
know.
I think that I personally feel a little bit better about some tips I can offer to my families who are going through these changes. And one of the biggest things is getting the sleep when you can, and understanding that it's just a phase. Understanding a little bit more about why you're not able to sleep train a baby,
Mm.
because it's designed for them to be able to like need to eat frequently so they're
Yeah.
growing and getting what they need. And that's why typically around like what you would say like the third to fourth month on average is when they're starting to have longer stretches through the night. And that's
Yeah.
when that they have more weight on and can kind of sustain themselves a little bit more too. And so I tell
Absolutely.
parents, hold on, change is coming.
I know. That's so true. It is. It is coming.
Oh, yes, indeed. So, thank you, Dr. Brown, for coming on. This has been such a pleasure. And so, when this video is posted, we will put how to reach Dr. Brown. She is available to help you and your family prioritize your sleep. And so we'll put her links to schedule with her and information. She has a YouTube channel as well. So we'll post that in the comments. And then if you want to talk with me about how to optimize your fourth trimester and get some tips and some strategies and some education, I'll also put my Calendly link so we can have a discovery call and just kind of see how I might can help you thrive instead of just surviving during your fourth trimester. Just remember, moms, you are super women, okay? And that doesn't mean that you have to do it all alone. It just means that you are special and you have the power to get it done. And so, anything else you want to add, Dr. Brown?
No, I think that's it. That's awesome. It's we're here to help. That's what we're here to do.
Yeah. Well,
Yeah, you're
thank
not
you. Thank
alone.
you to all our listeners. And if you, again, if you are watching the replay, put hashtag replay. We'll see that later. And then thank you to all who participated. We are so appreciative.
Thank
Bye.
you. Thank you.
Bye.